More than 1.2 million spine surgeries are performed annually in the United States, with surgeons from the state of Michigan conducting more than 25,000 of them each year. MISIC, the Michigan Spine Surgery Improvement Collaborative, tracks a majority of these surgeries through the collaborative effort of more than 30 hospitals and ambulatory surgery centers statewide. This collaboration reflects a commitment to improving patient outcomes, enhancing surgeon skills, and making a lasting impact in spine care.
The thing that I'm proud of about MISIC is to be able to work with very talented surgeons, spine surgeons, neurological and orthopedic, coming together, being open, sharing our data in an open and honest way, having surgeons come to the podium and say, here's where I'm struggling, how can I improve? And because of all of that, we're able to improve outcome and reduce complication.
MISIC is dedicated to enhancing care for patients undergoing spine surgery. With a focus on collaborative quality improvement, patient data is collected and analyzed in order to improve safety, reduce complications, costs, and episodes of care, making spine surgery more successful patient by patient.
Data really transfers into concrete numbers that can really help you see where you might be lacking or where you're really succeeding. And I think anytime you can have a decrease in an adverse event, you're going to improve your patient scores and they're going to be happier and go on to live a more fulfilled life, really. I mean, that's what we're here for.
At the heart of MISIC is data-driven improvement. We collect and analyze detailed patient data from hospitals and ambulatory surgery centers statewide, giving surgeons access to real-world insights that empower them to refine their practice. This ensures that every decision made is informed by the latest, most accurate information. MISIC has successfully implemented several quality improvement initiatives that have positively impacted patient care. Current and past initiatives include reduction of urinary retention, surgical site infections, emergency department utilization, and readmissions. More patients ambulated within 8 hours of surgery. Reduction of opioid prescribing at discharge. Implementation of comprehensive, enhanced recovery after surgery programs at all MISIC sites.
Patients have benefited to date by having fewer readmissions, a little effect on surgical site infections. That's a little tough one because the rates are low already, but we've pushed them down a little bit. Urinary retention is a problem a lot of people don't think about, but it can be a significant problem post-surgery, and we've been able to push rates of that significantly down. We're also working now on things like pain reports, functional status, return to work. We're beginning to see effects in some of those areas by some of the broader program initiatives that we're doing, like the Enhanced Recovery After Surgery program.
By applying best practices shared within the collaborative, surgeons are assisting patients in better preparing for their procedures and are helping them return to their lives sooner post-surgery. MISIC's Enhanced Recovery After Surgery Initiative, or ERAS, is a program designed to optimize and educate patients before surgery and assist in the healing process using vetted protocols and processes to ensure the best care is delivered consistently to each patient. With MISIC, it's not just about patients getting through their operation. It's about them thriving afterward.
I have to acknowledge that this work could not have been done without an amazing group of people that are dedicated their time and their life to do this. The surgeon and the abstractors, without their support, this work would not have been remotely possible.
As a MISIC partner, you're not just improving your own practice, you're contributing to a statewide mission to ensure every spine surgery patient receives the safest, highest quality care possible.
Without MISIC, we would be somewhat isolated. We would not have the communication with the other surgeons throughout the state. We would not know how we compare to other facilities and other surgeons. I see MISIC as kind of the glue that's kind of pulled all of this together, and it really helped us standardize the way we track and provide quality care for patients having spine surgery.
It's nice being able to collaborate with a lot of our colleagues across the state, see what's working well at other institutions. All of us coming together, really focused focus on patient care and having our leadership team coordinate with all of the different health systems across the state. I think we are the preeminent model that other entities should be able to emulate.
The active participation in MISIC puts you in a place where you are actively thinking about these improvement measures that we're studying, that we're following, that we're attempting to improve upon. If I wasn't doing it, I would be putting my attention a little bit somewhere else.
What I'm most proud of with our relationship with MISIC has been learning where we fall short across our peers. Without the MISIC collaborative, I would not know that our urinary retention rate was higher. Maybe the readmission rate or into the emergency room or to the ER observation was a little bit higher. And so implementing plans to help decrease those complications, pretty proud of.
MISIC has really embraced technology through some of their partnerships to help us record better patient-reported outcomes. And they provide the data for us to show us what we're doing and that we're doing it correctly, and allows us to make corrections if we're not doing it correctly. That also decreases the administrative burden on hospitals and physicians, and it allows us to practice what we love to do, is take care of people.
What you discover in MISIC is when you work with people that are different and have some different training and different views on life, if you pay attention, you learn from the people that you're with. And the only way to get to the best care for everybody, which is what we all want, is to keep reaching, keep improving, keep collaborating. There is no endpoint to delivering excellent health care. It just will be better for all mankind eventually, that we can take better care of people, which is why we're all here.
Partnering with MISIC means you're backed by a team of professionals who provide training, quality improvement support, data management, and administrative assistance. The Coordinating Center team works to define best practices and drive innovation in patient care by working with surgeons and healthcare providers to improve their knowledge and practices in spine surgery.
We come with a lot of benefits. Funding is provided by Blue Cross to support data collection and our collaborative QI work. We hold statewide meetings, which facilitates learning and collaboration. We provide site-level QI coaching, complete literature reviews, as well as tools, templates, and processes to support our initiatives.
For patients, this means safer surgeries, fewer complications, and better post-surgical outcomes. MISIC is committed to making spine surgery a smoother, more successful process, giving patients improved quality of life after surgery. By conducting surveys at the 90-day, 1-year, and 2-year marks, we track each patient during their post-op recovery to get first-hand feedback on how they're doing.
I think we've really impacted not just our patients at our hospital, but in Michigan and nationally and worldwide, actually, by again presenting this data, sharing this data, and showing what the true value of a collaboration between surgeons, caretakers, abstractors, and then all the sort of multidisciplinary team of people that are involved with spine patients, what that could really achieve for caring for this population.
With MISIC, we've been able to demonstrate that no, there are better ways of doing things, and we've created a platform where we can share these ideas broadly to be implemented across a real kind of heterogeneous environments across the state.
Together, we will improve outcomes for patients, enhance your practice, and reshape the future of spine surgery.